Organizations and volunteers from around the world are mobilizing to help Ukrainians displaced by the war. Border police in neighboring Romania say nearly 300,000 refugees have crossed the border since the Russian invasion began. Humanitarian relief groups like Project Hope are providing critical support for those in need. Tom Cotter is the Director of Emergency Response and Preparedness at Project Hope, and he joins us now from Bucharest, the capital of Romania, where, as we said, many Ukrainians have fled. Tom, thank you so much for joining us, and thank you and all of the staffers of Project Hope for the work that you're doing. Can you give us a sense of the situation on the ground where you are right now in Bucharest?
Thanks for having me. Today, the situation, as it has been for 2 weeks now, enormous amounts of people are fleeing across the border, fleeing the violence to seek safety and any kind of normalcy in Romania. And it's mostly women and children. As we know, men are not permitted to leave Ukraine right now. And there's been an outpouring of support from local communities, NGOs, and government workers. But the struggle is going to be to increase this as the numbers of people coming across keep increasing. And health-wise, not only are there the symptoms of war for the folks that are coming from Ukraine, the injuries, the mental health issues, the exhaustion and exposure to the elements, but there's also the normal health issues, the diabetes, depression, cancer, all of which are going to require healthcare services now and in the future.
You know, earlier today, the president of Poland was talking about the influx of refugees that they got there, and he was asked about whether or not the system could manage, because essentially the system is an improvised system at this point. They only had a couple weeks to put it together. And I'm wondering about the situation in Romania as well. It appears to me that it's a system that is helped by volunteers, organizations like you. But can the system hold if you continue to see an onslaught of refugees?
Well, I think that's the big question. And as of right now, the system is holding, as you said, but without additional support externally, internally, there is a real chance of things falling apart here. And I think it's admirable, the communities that have stepped up, the volunteers, the governments that have thrown open their borders to help. But this is not going to end anytime soon. It is only going to get worse. So preparing for that next step and preparing for even more people is absolutely critical to ensuring the safety of the Ukrainians fleeing the violence.
You know, and Tom, we, of course, rightly have been reporting on the physical danger that refugees from Ukraine are in, and how they've been, for those that are lucky, they've been able to escape that physical danger and find refuge in Poland, in Romania, and other countries. But I wonder, what kind of psychic toll are you seeing from the folks that you're interacting with, specifically young children? Because it's not clear when this is going to be over. And for all they know, when they get back to their homes, if they're ever able to get back, those homes may be gone.
This is an enormously traumatic event. As you mentioned, for children especially, families are separated. People have left everything they own, and they don't know what the status of their homes are in many cases. The mental health of folks fleeing, of refugees coming, is absolutely critical. It's as important as their physical health. Right now, Project Hope is working with partners to ensure that the volunteers that are receiving these people have adequate training in things like psychological first aid to help them overcome the acute phase of this crisis, and making sure that that folks that need additional counseling and additional therapy have access and good access to that care as well in these host countries. And we also have our team in Ukraine working on that in its own country.
You know, you're no stranger to these sorts of catastrophes. So I'm curious about how this compares to some of the other situations similar that you have stepped in to help. It just occurs to me that we're talking about people who, 2 weeks ago, we were talking, Vlad, about how no one was really taking it all that seriously in Ukraine. And the president of Ukraine was telling everyone to don't worry that much, and almost scolding the U.S. for exaggerating the threat. So I would think that for many of these people, this is a stunning turnaround. They thought this time, 2 weeks ago, this time, they thought they would be playing on their iPad or going to school or going to work or ordering a macchiato or whatever, and now they find themselves looking for a home.
This is an astounding disaster to work on. Project Hope, we routinely respond to natural disasters, and this crisis is very different for many different reasons. First of all, the scale of it. Right now, there's 2.3 million refugees as of this morning. That's That's the population of Houston, Texas, getting up and leaving in a matter of 2 weeks. In addition to that, for most natural disasters, there's the moment of disaster and things slowly get better from there. And this continues to grow in scale and scope with no end in sight. In addition to that, the places that we need to be the most, where the most vulnerable people are, we have very little access to them. And we keep pushing. And Project Hope will be here continuing to support with mental health care, medicine, medical supplies, everything they need. And it is going to be a very long process to get back to any kind of normal.
Tom Cotter, thank you so much for talking to us, and thank you for your work. I mean, there are so many gaps in the process, in the system, when it's pulled together at the last minute like that, and organizations like Project Hope really make the difference.
And as you say, Tom and Project Hope, I mean, I've seen your work on the ground, not just in Eastern Europe, Tom, but here in the United States, in the Caribbean. So thank you very much.
Thank you.